I really loved exercise, and it helped me out throughout my life. And it's something I enjoyed learning about. So I went on to study exercise physiology, and that kind of carried over to where a good specialty would be sports medicine, where you can work with active individuals to keep them active or work with inactive individuals to get them more active. I approach every visit the same way. There's different ways to connect with a patient for the same condition. So a patient could come in with the same joint problem, and the biggest thing for me when I walk in the room is I ask them what's bringing them in. And it's not because I don't know, I didn't look ahead. I usually prep my charts ahead of time and I'm well informed, but I want to hear it from them, because listening to the way that they say it, the words they use, the energy they say it with, it lets me know what type of conversation they want to have so that I can meet them at that. I can't just treat an x-ray. You have to treat the patient that's in front of you, and the other things fall into place. So if someone comes in with knee arthritis, but they also have weight issues, I don't ignore the weight issues. I try to address it because it's all going to impact the joint. And a lot of times patients may need a total joint replacement, and their BMI might be too high, or their A1C may be out of range for what's going to give them a safe surgery and recovery. So a lot of times the surgeons will refer the patients to me to medically optimize for their surgery so that they have better surgical outcomes and they have a better outcome after the joint replacement. I think the most rewarding thing is seeing patients get better. The easiest example to give is sometimes patients who are struggling with weight and they make a lot of progress with that. One of the very common things that I hear all the time is that moment, that milestone in their life when they come in and they tell me and they get emotional that I was playing with my grandchild or my nephew or my child. Things that patients typically notice about me is the way I tie my tie or the socks that I wear. So once patients catch on that I wear different socks, fun socks, usually they reflect my mood. Today I have on Jiminy Cricket socks, so they'll always ask, which socks are they today?